My name is Britta Lothary. I'm a clinical instructor too, and a fun fact about me is I danced in the Macy's Thanksgiving Day Parade when I was in high school with my drill team. A bunch of us girls went to New York along with hundreds of other girls around the nation, and as any 17-year-old would, we had a wonderful time. I work in both the didactic, so in the lecture setting, and the experiential setting, so the clinical setting. And one of the classes that I teach pretty frequently is pharmacology to the TBSN, or the traditional BSN students. And I also like to stay current, so that is why staying in clinical with the students and knowing about different practices that change in protocols and medications, it helps me stay updated with the lecture side of it. What I enjoy most is how we set up our program. So it's a flipped classroom. So students have to come in prepared with the knowledge. So there's either asynchronous lectures, reading, some activities that they have to do before class to be able to then come in and apply it during class, either in a form of like a game, an active learning game, or some sort of case study. So that's what real nurses do. We apply. We're not getting that knowledge in class, we're getting it before class and applying. I've really built a lot of fun games and a lot of different games to have students apply this material in a fun way, so it doesn't feel like class is just dragging on with me lecturing. They're coming in prepared. So that's actually my favorite thing about the School of Nursing.